Sometimes it's overwhelming. Some days we have patients sick everywhere. You have to prioritize who's the sickest. Your way of seeing life is different. When you have a 30-year-old, 20-year-old guy that dies almost into your hands, when you take your car and you go back home, you don't have the same way of looking at what you're doing or looking at your kids or family. Dealing with patients and their families, you see them happy. You have to pronounce people dead, tell their family. Young people, old people, you have to live with them these moments that are unique. And the arrival of bedside ultrasound in the ICU or any acute care environment is a revolution. But when you're at the bedside, you really want to have an answer to a specific question. So you need to have something that will help you go a bit further. We image the patient and we see something or we don't see it. But when you find it, that's quite a thrill. So this 44-year-old guy goes to the emergency room, has a big heart attack. He has 3 other sick vessels, so they send this patient for emergent bypass. He has 4 of them. He gets better in the recovery room. He goes to the ICU. He's doing okay initially. And then a few hours after, he starts having problem with his breathing, short of breath, oxygen level going down. So we try to stabilize him. You cannot move the patient while they are on this high frequency ventilation. So I did a bedside ultrasound on him of his heart.
At one point he just said to me, has he been on a trip recently?
So because he has clots in the arteries of his lungs, the blood cannot go there easily and the oxygen level is low. And the treatment is very different than what we were doing. So we had the suspicion of that with the bedside ultrasound, sent him for the test, found that he had that, and completely changed his therapeutics. 4 or 5 days after, he was off of the ventilator. He was extubated, talking to us. This guy has 5 kids, very charming wife.
Yeah, it's when I went back to the hospital for a monthly blood test. The nurse said, "You're lucky you have Dr. Beaulieu as a doctor, so you don't have to tell me that."
When I saw him 2-3 weeks ago in my office, he was coming back from Cuba, scuba diving, and I saw him half dead. And when you meet with this guy in the outpatient clinic, you're like, that's worth it.